One of the things that our Children and Young People's Group and Parent Carers Group say to us all the time is the biggest problem is communication. And they go across the health service. This isn't just about epilepsy. So to develop a product which actually helps with communication between professionals, that actually helps the young people, which is the second thing the young people say. We don't want to keep repeating the information. I know the families say it too. We want people to get it and to be able to transfer that information. And as we get older and older, and Owen's going to talk to us, I think he's 16 now, Sophie was telling me, Owen. So as life takes off, you need that independence. And it's very important that for that, the parents still feel you're safe and that you're fine, but you have that independence. So those are the two messages that come out of our Young People's Group and the Parent Carers Group. And nothing shows that as much as the new Epilepsy Passport.
We did an audit in the UK amongst all paediatricians, and it was published. Child Health Reviews UK is part of their clinical outcome review programme, and this is looking at epilepsy care and focusing on two particular populations of the epilepsies. One was those children with epilepsy who died, and the second population were those who had prolonged seizures who required attendance in emergency departments or admission. And some of those would actually then go on to die. Why do we need a passport? We felt it would help communication between the child and the family, the paramedic service and the hospital services, emergency departments, but within the wards as well. The clinical team looking after children and young people with epilepsies should consider introducing an epilepsy passport for all children as a means of improving communication and clarity around ongoing management.
Also on page 1, and this is all without even taking the passport out of the wallet, remember. You have the emergency care plan. So as we've heard a bit about emergency care plans, and a lot of us will know that young people, in a lot of cases, have very tailored emergency care plans. So it's important to know what you need to give, when you need to give it, what else can be given, when does it need to be repeated, when should an ambulance be called. All of that information is extremely prominent and on page 1. So next, who should create the passport? Well, it's any member of the clinical epilepsy team, actually. So that will often be the consultant, maybe the paediatric neurologist. It may, in a lot of cases, be the epilepsy specialist nurse. It could also be as an experienced doctor who's involved in the clinic as well. We see that being done in the epilepsy clinic in an outpatient setting, which in most cases is in the hospital, but obviously it can also be in a community setting too, if that's where they're held. This third point is absolutely key. So we talked about the involvement earlier on in the look of the passport and the look of the wallet, but actually that information needs to be done with young people and with parents and with families. There's no point in, as professionals, filling this in separately and, heaven forbid, post it out or just give it to them on their next visit. They need to be involved from the very initiation of the passport and the creation of their passport. It's also who will carry it. Well, I've already covered this a lot, and I think Richard mentioned it too. This is the truly innovative thing about the epilepsy passport that you're hearing about today. It's the child or the young person that carries it, or the parent if they feel that their child isn't old enough at this stage. But it's on their person at all times. Whilst our primary care, what the Child Health Review talked about was emergency care, we also have the option, as Richard has also touched on, of sharing it with whomever you want to. So that might be schools or colleges. So if there are issues with, let's say, stigma or fear or just a bit of a lack of knowledge, it makes it plain for people in education as well to be able to look at this and to know what to do, and hopefully reduce that level of fear, reduce that stigma.
For us, the passport is another opportunity to talk to Dylan about his care plan, and that's really important. You know, I hope that it'll give him and other teenagers a real sense of control and ownership of their condition, and that's really important. So this idea that he's going to be carrying a mini care plan is really important to us. It means that whoever is going to treat him, if he has a seizure, will be able to make the right decisions about his treatment, and they'll be able to do that quickly, especially if he needs rescue medication. So, and this could make a very big difference to the outcome for him. So it's really reassuring to us as parents to know that he'll have this information in his pocket wherever he is when he's out and about without us. So I really do believe that we need to take every opportunity that we can to educate the people that come in contact with our children about epilepsy, and I really also feel that the passport does this. The passport will help us as parents. It's really positive. I mean, it will provide anyone looking after our children with the information needed to make the right decisions about their care. And this will make it a lot easier for us as parents to allow them to live independent lives. So that's really significant. I think the passport will help us to support our children to manage their conditions themselves, and it will help those around them to have a better understanding of epilepsy.
If used by all young people with this condition, it will save doctors, paramedics, and even parents and carers valuable time trying to find out and communicating a person's seizure history. All of the information will be clear, up to date, and succinct, as well as being easy to understand by all, be they NHS staff or members of the public. Parents and young people will feel less anxious in meetings, knowing they don't have to relive every horrible moment of every horrible seizure. It would also mean that a young person with epilepsy can have more of a normal teenage lifestyle. Going to the cinema or being out with your friends has an added element of risk, when you never know if you might wake up in an ambulance or in hospital. Carrying the epilepsy passport would provide a bit of a safety net, giving parents a sense of security and the young person a bit of extra freedom. This time in 2 years, I will hopefully have just started studying at university. The epilepsy passport would bring peace of mind to me and my family in any transition of care. I myself have had a few seizures in public, and although I was lucky enough to have friends or family around to help me, under different circumstances it would provide the essential information for whoever is in the right place at the right time. I believe that a product like this has the potential to save lives.
But thank you mostly to all of you who've turned up. I know you've all got, all the clinicians, you've got very busy lives. Everyone else has got very busy lives. You've turned up on a Friday here in the House of Commons, and you've helped launch this amazing epilepsy passport. Let's make sure we tell everybody about it, and I'm sure we will, and it'll be an outstanding success both in England, the UK, Europe, and throughout the world, because this is, the World Health Organization did have a resolution on epilepsy this year. So let's make sure we spread the word through all our contacts and all the diaspora. Okay, thank you very much for coming. Thank you.